Have you ever wondered why does your kid like to put a lot of food in their mouth or mouth stuff? We talked in the first part 1 about the dangers of mouth stuffing, for risks for airway obstruction, that you should get their head to look down and never do a sweep in their mouth. But let's try to avoid that situation at the beginning. So what are some things that you can do? And one of the first things that I do in my therapy sessions is I teach children what the right size bite is for them. And I'll say, Christopher, is that a Christopher size bite? Or maybe they like a certain dinosaur, or maybe there's some cartoon character that they really like. Whatever gets them excited is what I use. But I do like to use their name because that helps it become more personal. So we'll talk about, is that the right size bite? And if you have a child that just automatically takes everything off the tray and places it right to their mouth, you're going to have to do what's called external pacing, which basically means that you cut the right size bite for your child, and when they're finished with their mouth, so you can say, let mommy see, is it all gone? Did you swallow it? Then they can have another bite. And they may be very resistant to that at first if you're not used to, or they're not used to having you pace them. But keep reminding yourself you don't want to get in a position where your child is obstructing their airway. So it is in their best interest that you're providing that pacing. So providing the pacing, the right size bite, the right size pacing, all of those will help your child use the correct and the most optimal oral patterns in their mouth to chew the food. Because if their mouth is so full of food, they're not going to use very optimal chewing patterns, and they're not going to develop optimal chewing patterns. And you're going to get stuck with a kid who likes junk food, and that's pretty much all they're going to be able to eat. So hopefully this was helpful. Please like it, please subscribe, and I would greatly appreciate it. Again, this is Joan Comrie, a speech pathologist, feeding specialist. The way to access me is at feeding.com, and I'd be happy to do some parent counsels and consults and help you. Or of course, obviously I have an office that you can come and get some feeding therapy if you're in the St. Petersburg area. So thanks for your time. Hope you have a great day.